Hey, this is Connor with Conquest HP, and this video is about why recovery from pain and injury always needs to include strength training. It might seem odd for a manual osteopath like myself, whose clinical work is almost entirely hands-on work, to advocate strength training so much, but I really do believe that it's the only game in town when it comes to sustaining clinical effects over time. So anytime you experience pain or pain coming from an injury for more than a few days, your body really starts to adjust how you get through the day, how you perform normal tasks. If you have pain around a specific area, a joint, a tissue, something like that, it will start to change muscle activation around the area. So it might start to use certain muscles more than it has in the past. It'll start to deactivate some muscles because sometimes when you have an injury, contracting a very specific muscle in a very specific way hurts. It causes pain. If it causes pain, your body is going to find a way to avoid that pain. You're going to do it as well, but your body's just better at it. So it's going to start deactivating certain muscles that would normally support a particular movement. Now you still have to do that movement if it's brushing your teeth or combing your hair or whatever it might be. So your body's going to find a different way to do it. It's going to start to use other muscles that maybe aren't as well suited to that movement, but they'll do the job for now. So these changes start to take place after, like, can be after a few hours after you have started to experience pain. But the longer they go, the more consequences there are. So when we push that out 7 days, 10 days, something like that, when you have deactivated muscles, to avoid using them because using them hurts, that disuse is going to lead to muscle weakness. You're not using the muscle anymore. You're not loading that tissue anymore. If you're not loading that tissue, your body is going to start to atrophy that tissue. It thinks you don't need strength there, thinks you don't need muscle mass there, and this starts happening very quickly. So all of a sudden you have a muscle that you would normally use for a particular task getting weaker because you're not using it. So even if you start to feel better, even if pain seems to be subsiding, it's going away, when you go back to trying to use that muscle in that movement pattern again, it's going to be too weak to do what you want it to do. So you're either going to have to change that movement pattern permanently. So that's talking about building a compensation pattern that we just live with forever, which, just as a sidebar, doesn't usually work out too well. Compensation pattern usually means that we're using muscles that aren't suited to a particular task to do a task, and that can lead to overuse in a lot of cases. But so we're either going to find a different way to perform that movement and do it permanently, or you're going to start to try to use that muscle again in that movement pattern. Maybe it's something as simple as walking and your body decides, hey, I can start to try to contract that muscle again. That's fine. But now the muscle, because it's atrophied a little bit, you've been away from using it regularly, it's not capable of doing what you want it to do now. It has lost strength, it's lost endurance and mobility. So if you try to use it as you did before, it's going to get irritated almost immediately. And this is why you see someone going to the clinic for a little bit, feeling better, going back to normal daily activities and sports and all that kind of thing, and then going right back to the clinic because the symptoms just reappear. This can become a long-term cycle, and it's not a good cycle to be a part of. And what it ends up looking like is exactly that over and over again. So you feel better for a little bit because the therapy has loosened things up. You go back to trying to do your normal stuff again. That hurts. So you go back to therapy again, feel better. You see the picture. That can go on forever. A lot of people just end up living like that. That is totally unnecessary. If we had a targeted strength intervention, if we just had a few simple exercises that could build strength in a really safe way for that affected tissue or that affected joint, then we could build that resilience. We could build that capacity back into that area. And if we did that, we would not have to compensate around it. That tissue would now be capable of doing everything we want it to do because we have intentionally targeted it in that way. So if we do that, then there is no cycle. You don't have to keep coming back to me to get a tissue released because it's irritated again. That tissue is just capable of doing everything you want. It has that capacity. So That can only really be done through strength training, through hands-on therapy, massage, osteo, acupuncture, cups, whatever your favorite therapy might happen to be. No one can insert strength into a tissue other than you. The only person that can take care of this is you. You can get guidance with exercise through someone like me or through physio or through an intelligent trainer or something like that. But at the end of the day, you have to load that tissue. You have to engage in strength training to make sure you bring that muscle capacity or that joint capacity back up to where it needs to be. You should assume that it is not where it needs to be. Anytime you've had pain or injuries for more than a couple of days, assume that area is now a little weaker than it needs to be. Pay close attention. Do something intentionally to make sure it's returned to full function. Really test it, but do it in very discrete, controllable ways, like exercises. Go to the gym, do some single leg work on each side, and make sure that there's not a significant strength discrepancy there. Without doing some strength training, we're just accepting that a muscle is maybe atrophied a little bit, it's a little less capable, and we're okay with living with it. And it's just a matter of time before that becomes a problem. And I don't know of any therapist that would really sign on for allowing a patient to just go through these recurring bouts of unnecessary pain over time. And that's really what they are. So if that's you, if that sounds a lot like your issue, feel free to reach out. You can contact me through YouTube or social media, wherever you're seeing this. But there's a good chance that you haven't done the necessary strength training to get yourself out of this issue permanently. If you just keep going back to the well to releasing muscles over and over and over again, there might be something else to address. So check out the other videos on